Sid, welcome to the program.
Nice to meet you.
Well, if you could briefly introduce yourself, that'd be great.
Alrighty, I'm Sid Schechet. I'm an ophthalmologist and a retina specialist in Baltimore, Maryland. I work at the Elman Retina Group with Dr. Michael Elman, who is a fantastic partner and mentor. And I see tons and tons of patients of all kinds from all over the place with every kind of retina disease imaginable. And I fix them. Also, in our practice, we have a very, very busy research division where we run many clinical trials and present data and publish a lot of our projects. So we have our hands involved in many different activities.
That's great. Well, digital health is a buzz term being used throughout medicine. What is digital health and how is it being used in patient care today?
Digital health is basically using technology to help improve patients' health. Simple as that. And it's already being done routinely all over the place in medicine in many fields. For general medicine and diabetes, a very common disease, unfortunately, there is continuous glucose monitoring devices that are associated with many different companies and varieties where they monitor and help improve glycemic control. In the eye care field, there's the eye care home device that at home the patients can check their own eye pressure, and through this self-monitoring they're able to track diurnal IOP measurements, and that helps in diagnosing and monitoring and managing glaucoma. Other examples in the cardiology field, for years now they've had monitoring of cardiac rhythm and heart rate, blood pressure that sends the data back to central databases. During the pandemic that we all are experiencing, the advent and growth of social media and other apps has grown exponentially, with contact tracing proving instrumental in helping curb minor outbreaks by identifying people and helping prevent the spread of infection from the coronavirus.
So if other areas of medicine are already improving outcomes with the use of digital health, how can it help improve outcomes in eye care?
How many hours you got? Digital health has the potential to help in many, many, many areas of the eye care field. But specifically, when speaking about age-related macular degeneration, or AMD, adding digital health services to office-based care enhances the ability to detect wet AMD conversion and initiate treatment so that the patients have a better chance of preserving their vision long-term.
Now, how is the current AMD standard of care doing in terms of helping patients maintain their good vision long term?
Let me be blunt about it and say not great. A recent retrospective review of just about 163,000 eyes that were enrolled in the AAO's IRIS registry that were diagnosed with wet AMD in one or both eyes found that the eyes that presented with at least 20/40 vision or better were able to maintain the same visual acuity after 1 or 2 years of anti-VEGF therapy. Whereas, unfortunately, the eyes that presented with 20/40 vision or worse were not able to maintain or improve that vision to 20/40 or better at the 1 or 2 year mark. That's not good. Although the study was designed to investigate a link between baseline vision and long-term vision outcomes, another data point in the study underscores the urgency in detecting conversion to wet AMD as early as possible. Only 34% of the eyes in the study presented with 20/40 vision or better. That means that 2/3 of the eyes, 66% of patients in real-world practice, were unlikely to ever get to 20/40 vision, even after 2 years of monthly anti-VEGF therapy.
So how did you incorporate digital health for monitoring patients with intermediate dry AMD?
During the pandemic, I really relied heavily on the Notal Vision Monitoring Center, the digital healthcare provider of the ForeseeHome AMD Monitoring Program, for all patients I was following with intermediate AMD. I was able to capture conversions from dry to wet AMD in a number of patients who were still asymptomatic. Thereby, I was able to start treatment with anti-VEGF therapy much earlier than if we would have waited till they became symptomatic. And the long-term vision gains are already showing themselves. Although it was less tangible, one of the other things I heard from patients enrolled in the monitoring center, but one of the most important things for me that I took away from this, is that these patients felt a strong sense of security that anything was being done for their eye care while they were quarantined and unable to leave their homes and apartments, nursing homes, etc. So by starting and having the patients on this ForeseeHome device, what they started telling me was that a lot of their anxiety was washed away, was erased, and they felt much better, at least by having that. By washing away the fear of their AMD converting to wet without anybody catching it was a strong sense of relief, not just for their eyes and their vision, but for their overall well-being and their mental well-being.
Meanwhile, Sid, what are the real advantages of digital health and remote monitoring, and are there any disadvantages?
As the pandemic progressed, I'll put it that way, that patients were starting to leave their homes and nursing homes were allowing them to go out for appointments. So we were getting busier in clinic again, in a way transitioning back to the traditional model of the eye care us retina docs provide. The idea of using remote monitoring remained critical. For one, the recent experience during the pandemic provides an excellent example of how technology facilitates the kind of individualized care that is likely to improve outcomes. Literally, quite literally, remote monitoring extends the retina doctor's ability to care for patients in between office visits. Technology and the monitoring involved by using this advanced technology isn't an either-or kind of thing. It helps, it's a teamwork. It's a way to practice better medicine together, not remote monitoring or clinic monitoring. Even if we follow patients every month, this provides a huge help on a daily basis. The ForeseeHome program is ahead of the curve in demonstrating a new model of retina care. Results from the 2014 AREDS2 home study were clear in showing that individuals at risk for conversion to wet AMD benefited from home monitoring in addition to the standard of care versus just standard of care alone without the home monitoring. And the just standard of care was including things that we're all used to, like the Amsler grid. In fact, the trial was ended early. This is crazy. The trial ended early, not because something bad was happening, but because it was deemed that eyes at high risk for conversion could be identified better when using the ForeseeHome device than without the ForeseeHome device. So since the time of that study, the service supporting the device has only gotten better, making it an excellent option for providers, for retina doctors that still deliver high quality of care to benefit the patients. This was demonstrated more recently in a retrospective review that was presented and later published by Dr. Alan Ho at the 2020 ASRS meeting, where he analyzed the ForeseeHome patient data over 10 years, and the results were comparable to that AREDS2 home study I just mentioned, where 81% of patients retaining at least 20/40 vision when wet AMD was detected. You don't often see real-world data reflecting so positively the results of a clinical trial. It wasn't a surprise when you can see the audience members slightly aghast when Dr. Ho presented that data. A common misconception that eye care doctors have of the ForeseeHome program is that they assume it's a big headache and time-consuming process to set up for the patient and teach them how to use it and going through all the motions, and simply would increase the patient's chair time in clinic and slow everything down. I have to say that's a huge misconception, and I'm guilty of that too initially. I'm still amazed of how easy the Notal Vision Monitoring Center makes everything for me and for my colleagues who use it, who prescribe it. There's simply, I'm not exaggerating, there's no extra time needed from the doctor, from my staff, which is my time. It's not a burden at any point in the patient's encounter. Another seemingly disadvantage is that this is a piece of technology. It's high tech, it's advanced, it's state of the art, and that the average AMD patients on the elderly side, I'll put it that way, it's just conceivable that they wouldn't be able to handle the technology and they'll struggle with it. And that would lead to more phone calls and instructions and whatnot. However, all my patients have mentioned how helpful the monitoring center has been during the onboarding process and whenever they had any questions. They spend time on the phone patiently teaching the patients how to use this actually uncomplicated device.
Sid, can you meanwhile explain the impact of digital health on your practice?
Of course. One of the most important things to recognize about the Notal Vision Monitoring Center is that there's simply no cost to the practice to participate. There's no cost that I saw, and I was looking for the loopholes and and all that kind of the tricks that we're used to with insurance companies. And there's no cost from the time spent doing this, because like I said, there is no lost time setting this up. Once we make the referral to the monitoring center, they do all the work helping the patients with everything from obtaining insurance coverage to shipping the device and training the patient on how to use it, troubleshooting any questions that arise over time. They do everything. Patients are instructed to use the device daily to perform preferential hyperacuity perimetry testing. Data from the test is analyzed by artificial intelligence-based algorithms, and then it's transmitted to the monitoring center via secure, HIPAA-compliant health cloud. Any significant deviation from the baseline signals an alert that is reviewed by the in-house ophthalmologist at the monitoring center, and then the referring doctor's office is notified. So that's another step that isn't taking time from my day. I'm not the one analyzing every single day's data. It goes to this monitoring center, which is, I think, the crux and the key to everything here. Trusted ophthalmologists, and then they alert us when there's a red flag that needs to be looked into. Importantly, the referring doctor always maintains 24/7 access to the daily testing data via an online portal, which may be useful for interpreting early changes detected on a patient's imaging studies. I can log on to this website at any time. I do it in front of the patients in clinic sometimes to show them. All these aspects have been specifically designed to complement the already established routines that the eye care providers, that the retina doctors, that I already use when following patients with intermediate AMD. That's to say, at-home monitoring is not intended to replace or replicate in-clinic monitoring or to replace us doctors, but instead, it's designed to be used as an adjunct and advanced tool to help improve and extend patient monitoring between in-office visits. It's not a either or, it's not a competition, it's teamwork. It's teamwork that leads to better care, advancing the care, and making everything even better for the patients long term.
So how has remote monitoring been embraced by your patients?
Well, I said it many times, and I'll say it again. It was a lifesaver for me and my partner during the pandemic, for the nursing home patients and the immunocompromised patients who couldn't or weren't allowed to leave their living facilities for many months, not just a few days or a few weeks. Some of them couldn't leave for 8 months even. And it was a lifesaver for them, which was a lifesaver for me. For most, it was the peace of mind that they were able to at least have some sort of macular monitoring being done. But also, there was actually a few instances where patients who weren't planning on leaving their residence, but had a ForeseeHome alert that we recommended and urged them and prompted them to come to clinic for an exam, only to actually find, unfortunately, but fortunately, an early conversion to wet AMD before their vision was affected, to start and initiate the anti-VEGF injections to preserve their vision. Basically, success stories.
And what would you tell physicians who are hesitant to embrace digital health solutions like remote monitoring with ForeseeHome?
How can I eloquently put it? Stop being such scaredy cats. But in all seriousness, first of all, it's our responsibility as doctors to present to our patients all options for any disease at every visit. We have to present all the options for their health care, what's out there, whether it's the treatment modalities if they convert to wet AMD, or the different options for monitoring disease status, their macular degeneration, whether it's the Amsler grid or the ForeseeHome device or anything that's available. I recommend to physicians to at least try this innovative modality on a few patients at first who are more experienced with technology and have the personality where they are fully involved and passionate about their own healthcare. We all have those patients who come in with a big binder and novels and novels and novels of every single visit that they've ever had. And I look at it as great. I have a teammate. I have someone here helping me care for the person in the chair over there. Those are the ideal patients to test the waters with when starting with the ForeseeHome device. And it's through those experiences with the device that will demonstrate to the prescriber that the various benefits are there with the ForeseeHome device, and there's a lot to offer.
Sid, you're obviously very passionate about this topic. Really want to thank you for joining us today. Before we go, is there anything else you'd like to add?
There's tons to add, but I guess I'll leave it as not just as a doctor in medicine, but in life. We're all living through hard times that hopefully will get better. But we should never be content with where we are. We should never be content with this, where we stand with macular degeneration monitoring. Compared to 10 years ago, we're doing great, but that's not where we want to be ultimately. We always want to improve. We always want to strive to push the boundaries and advance and make things better and better. We're never done. And I think the ForeseeHome device is a great example of that.
Well, Sid, thanks for coming on the program, and you're welcome to come back anytime and share more of these innovative thoughts.
Deal.